Welcome to the Dallas Duo Podcast,
your weekly wellness coffee date.
We're friends in Dallas, always looking for the best ways to optimize our health
and have fun along the way.
Today, we're diving into one of the most fascinating and fast evolving topics in women's wellness, the modern applications of LDN or low-dose naltrexone.
We're joined by Everest Goldstein, the founder of Everest Functional Psychiatry and Wellness here in Dallas. Everest is a board-certified psychiatric nurse practitioner with advanced training in functional medicine. She blends conventional psychiatry with root cause integrative care to help women reclaim their mental health, hormonal balance, and energy. Welcome to the podcast, Everest.
Hey,
Thank you guys. Thanks for having me.
We're so excited for you to be here and recap after Witness Wellness, everything that people learned there. I feel like there was so much interesting questions.
Yes, I got to sit in on that panel, and it was really the first time I'd ever heard about this. So I'm so excited to learn more.
Yeah, no, I'm super excited to chat about it. It's a tool that I found super helpful in my practice. I've taken it myself as a patient, and I feel like you said, not a lot of people know about it. And it's something that I think is emerging and really helpful for us, especially as females, to know about it as something that we can use potentially to benefit ourselves.
You have such a unique background from Princeton to SMU to Vanderbilt and now functional psychiatry practice. What inspired you to take this path?
Yeah, so I mean, I've taken a long-winded path. Some of you guys may know I was an elementary school teacher first, but from a really young age, I come from a family of people mainly in healthcare and education, a lot of service-related jobs, some social work, that kind of thing, and doctors and whatnot. So I was kind of exposed to healthcare at an early age from that perspective, but not the functional side of things. I'd always been really interested in it, and I knew from a young age that I wanted to work with people, to serve others, to work in communities. And so I kind of went back and forth between education and healthcare for a long time, started in education. And then with a lot of my students, I was working a lot with the special education population at my school and just noticing the need for greater resources in that regard. I had majored in psychology at Princeton undergrad. And so I'd always been drawn to that just as a interest in how people work and how our minds work and our brains work. And then after that experience teaching, I knew that I wanted to dive into it more. So I decided to go back to school, get my nursing degree and then my advanced nursing degree in psychiatry. And then through this whole journey, I actually got Lyme disease myself and got really sick. And I went from doctor to doctor, was just kind of getting worse, and stumbled upon a functional medicine provider who really changed my whole life and opened my eyes to what that was. I had no idea what functional medicine was. I had no idea what the integrative health side of things really meant or what that looked like. And then, I just got really interested in it personally because it kind of gave me my life back. And then from a professional standpoint, I was like, this is really why are we not asking these questions? Why are we not digging deeper and treating patients in this way? And so really dove into that and have just found that in my own practice, whether it was working for somebody else or now with my own practice and my own patients, it makes a whole new level of difference with people to really take a step back, look for that root cause and address their whole body overall versus just their mind or just their gut or just their heart,
So in going through that whole experience, with what you experienced with Lyme disease and being in the educational space, were there certain gaps that you saw in conventional mental health treatment?
Yeah, I think so. In conventional psychiatry, in my personal opinion, it's the furthest behind out of all of the medical fields. I was trained to kind of look at the mind as separate from the body. Let's cut off ourselves at the head, and our head's one thing and our body's something else. And that's just not the reality, right? What happens in our body is affecting our brain and our mental health. What's happening in our brain and what's going on with our mental health is also affecting the rest of our body. It's all connected and it all should be looked at as one. And then the conventional method is very medication heavy. So we diagnose you kind of based on somewhat subjective symptoms, and we come up with a diagnosis, and then there's a medication to treat it typically. But we're not really asking the question of why you're having these symptoms. So, if it's depression or anxiety or ADHD, we're not asking the question of like, okay, where is this stemming from? Is it something where maybe an SSRI might help, or is it something completely unrelated to the serotonin in your brain? Is it something that has to do with hormones or inflammation or gut health or nutrient deficiencies? And that's where the functional side of things really comes in, is to take a step back and say, like, what else is going on in your body? Are you being exposed to toxins? Do you have a big history of trauma? What else is going on that's driving these symptoms?
Mhm. Yeah, it's so interesting you say that. I'm thinking about how many of my clients have had severe nutrition deficiencies who also struggle with mental health. And it's so rare, you know this, that a provider says, okay, I'm putting you on this medication. And this medication also depletes all of these nutrients. And so
Hmm.
we're going to do both. You get down this path of, oh, I've been on, this medication for a decade and my provider didn't take an integrative approach. And so here I am worse off maybe than I started because of those things not being looked at from a holistic perspective.
Yeah, definitely. I think that's a good point. And I like to point out, like, I'm not against medications. I use them in my practice. I think there's a time and a place. But we also need to look at, like you said, how are those medications affecting our body? How do we support your body going through them? So if somebody is on a medication that's depleting nutrients or changing your gut microbiome, we need to support your body in that way to make sure that no other negative symptoms come about from taking the medication.
Exactly. Yeah. Yeah.
That's a really great point because I think a lot of people are unaware of that.
So LDN is a medication. For individuals who don't know what low-dose naltrexone is, can you give them the quick and dirty 411?
Kind of want to step back a little bit. Low-dose naltrexone is an amazing repurposed medication, and
Mm.
that we have a medication called naltrexone, very common in alcohol use disorder to decrease cravings. And we start that at a minimum typically of 50 milligrams a day. And it's for alcohol and opioid dependence, addiction, and stuff like that. Well, they've found since that if you take naltrexone, and instead of starting it at high doses, if you microdose it, so starting at like even 0.5 milligrams, going up to the standard doses to get to about 4.5 milligrams a day, it has very different effects that
Mm.
support the immune system, calm inflammation, balance the nervous system, all sorts of different things. So it's basically a repurposed medication that has very, very minimal side effects at these doses that actually supports a lot of times our body's healing process and inflammatory processes, as opposed to just like treating disorder. It's very different than that.
So, in your practice, how is it most commonly used? Like, what's your favorite application for like the modern woman, maybe?
The thing with LDN is it has so many different benefits and it acts on our body and in specific ways that lead to a lot of relief depending like for a variety of symptoms essentially. So I love it for anybody who's really struggling with inflammation. I guess my top go-tos are like inflammation, autoimmune disease, chronic pain, and really depression too. It's
Mm.
something that I've used to get people off of antidepressants, to lower their doses, to just complement them or use in place of them. It's really great. So it actually has a lot of benefits for thyroid health. It can
Mm.
help your thyroid function better, especially if you have more of the Hashimoto's autoimmune presentation of thyroid disease. So there's a lot of benefits there. The pharmacist that I work with, who's a big LDN researcher. I remember one of the first conversations I had with him is he was like, anybody who has Hashimoto's, I think it should be a law that they're on LDN.
Mhm. Yeah.
Um, and that just stuck with me because, it was just showing that like there are such, any medication has side effects, but they're so minimal with this medication. And if you are struggling with something like an autoimmune disease or just inflammation, like maybe weight gain, a little bit lower mood, it can be super helpful there.
That's really funny. One of my best friends from home, her mom is a pharmacist and now she's retired and she actually speaks for LDN like
Oh.
nationwide. And I always joke because I'll text her and be like, "Could I use LDN for?" And she's like, "Of course you can." Like she's like, "Here's the research," and it's so interesting to me that it is so
There's so many applications, it sounds
diffuse in
like.
the areas that it's used. And I feel like that's so rare, honestly, to find a medication that has so many different components of benefit.
Definitely. I completely agree. I think it's really amazing, like all the different benefits, and a big way that it works. So LDN, when we take it, it binds. Typically, people take it at night because of the way that it works, but some people will take it during the day. But it binds to our endocannabinoid receptors. So they're the ones that deal with pain, with mood, stuff like that. So it binds to them, which is why if just a side note before I forget, if you're taking any opiate medications or going to get a surgery where you may be on pain meds, you don't want to take it because it will bind to those, and the pain meds you may have either like withdrawal or
Oh.
other issues with that. But it binds to it for about like 6 to 8 hours, and then it releases from those receptor points. And when it releases, it causes our body to produce endocannabinoids or like endorphins. Right.
Wow.
And so it reduces our pain. It also impacts our inflammatory cascades in our body. And it also improves mood because of those endorphins. So it's really great for like any pain, mood, inflammation. A lot of people take it at night because it's binding to those receptors. And then when they wake up, they're getting some of those benefits. But if you take it consistently, it doesn't really matter.
So you touched on this a little bit. You see a lot of female patients. Where does LDN fit into issues? Well, you mentioned thyroid, but for things like perimenopause or chronic fatigue.
Yeah. So one of the biggest effects that my patients who take LDN will tell me is that they have a lot more energy. So it really, really helps with chronic fatigue. A lot of times inflammation can be a big part of chronic fatigue. And just again, with those endorphins, endocannabinoids, that can help. And then with perimenopause, fatigue, as we just talked about, is a big symptom, but also like a lot of mood changes happen with hormonal changes. People start to like kind of gain weight, hold on to, have more inflammation, holding on to water retention, that kind of thing as well. A lot of times weight gain can be because of inflammation in the cells, in the fat cells in particular. So if we can lower that, that can be really helpful. It's really great in regulating sleep as well. And then also with hormonal changes, our immune system changes, right, as females, and our mental health changes with the lower mood, more anxiety. So this is really helping all of those things in different ways, which is really great. A lot of people's autoimmune conditions will sometimes worsen during perimenopause as well. And because of the effect on autoimmune disease, this can be really, really beneficial there.
That's amazing.
I love that because I think you like to talk about like food is medicine, but I think sometimes in certain seasons it's like, what can I do to complement and amplify and catalyze my food is medicine?
Mhm.
Because I'm suddenly in this place where I'm having so many symptoms that it's overwhelming to think that I'm going to have to rely on food only. And so it's like food first, but maybe not food only in this situation. So we can complement it with something that doesn't have a significant symptom load and benefits you and doesn't, lead to more nutrient deficiencies in the long run.
For sure, for sure. I think it's a good complement to that, right? Like, yes, we should always be thinking about food as medicine, but sometimes some people, for whatever reason, may need more, or they may need a little kickstart, right? So it can be really, really helpful there. It also, in perimenopause, but also if you think about earlier, anybody who has like PCOS or endometriosis, any other pelvic pain or PMS symptoms as well, it can help with all of those. So it's really great for just, anybody in general, but especially females because of the effects on our hormonal symptoms.
Any concerns or usage issues with long-term use versus short-term use?
So there's like mixed research in terms of this, but it's something I've been doing is long term. It like some people will say, hey, it may have less of an effect. But so what people will say is take what we call drug holidays. So like 1 to 2 days off a month. So if you're taking it, maybe you like go on a trip and you don't take it with you, and then it's supposed to help it work better. There's not like a ton of research on if that's like super needed, but it's not going to hurt, especially if you've been taking it for a while and maybe you're like noticing there's more inflammation or you don't think it's working as well. It can definitely be helpful there. The main like side effects that people will see, well, one, again, you don't want to take it with any opiates, and that's the main thing. But Side effects, I would say the main thing that I hear is it can cause more vivid dreams.
Mhm.
And so some people don't like that, or they're like, it's not that, I have vivid dreams now, but they're not bad dreams, or it's not that bothersome. So sometimes that can impact some people's sleep. If that's the case, you can always take it in the morning. That usually helps with that. But it's not typically like drug limiting, meaning it's not typically preventing people from taking it.
Okay, that makes sense.
Functional psychiatry feels like the future of mental health. How do you help women move away from the idea that medication is their only option? Now, we touched on this a little bit, but what would you say?
Yeah, I mean, I think one of the biggest things that I really try to do is just increase education around mental health in general. Because a lot of us, especially as females, we're not talked to about what's going on in our bodies and that kind of thing. Or we're just told, hey, it's in your head, you need to take a medication, that's your only option. So I really like to educate that could be more going on and really take the time to sit with my clients and get to the root cause. So I'm really focusing on, okay, like what's driven these symptoms? And medication may help and maybe something that might be beneficial in the short term or whatnot, but it's never the only option, in my opinion. It's I can't think of a time that it is the only option. A lot of times, if we can figure out what the root cause is and address that, then they can have a lot of relief. So, looking again, like at the gut, the hormones, thyroid, the autoimmune stuff. And this is where LDN can come in and be a really good tool because it can help resolve some of those root causes. And then also, again, educating on really the research behind things like antidepressants, where they can help some, but they're really failing for a lot of people because that's not the issue, right? It's not an issue with our neurotransmitters always. Sometimes it is, and that can be helpful, but it's not always. And then if that's our only option, we've just failed like half the population. So
Well,
we
and it
need to,
seems like there's so many side effects with those too,
yeah,
more side effects than with this.
definitely, that can affect mental health again, right? Like
Mhm.
antidepressants will change your gut microbiome. 95% of your serotonin receptors are in your gut. So when you take a SSRI that's acting on serotonin, it's not just going to the 5% of receptors in your brain, it's also going to your gut, which is why some of the most common side effects are those gut symptoms. Um, but if we are just taking that and not even addressing the gut, then again, when our gut microbiome changes, that's going to negatively impact our mental health as well.
Yeah, the idea of specific bacterial strains in your gut that affect mood is always one that my clients are fascinated by. Like, I'm like, hey, like there's these probiotic strains that would be really beneficial for your mood. And they're like, excuse me? I'm like,
They're
yeah,
like, "That's my
they're in your
stomach. What are you
gut,
talking about?"
Like it's fun to have this whole body conversation because again, like let's work with the whole body because it is a, integrated thing.
Yeah, there's so much like research around, we call them psychobiotics and mental
Yeah.
health. And it's those strains that are great for your gut. But I mean, I wasn't taught that,
Yeah.
so
Yeah, I've
it's a
never
lot
had a
of
patient
people
come to me
don't
saying,
know.
I'm on this medication, and because of it, my doctor has prescribed that I eat these foods, that I
Yeah,
keep my gut healthy or, even just to help like support liver health and recycling, all these things. Like that's not usually the case.
exactly. I completely agree.
Which it should be. I feel like you should
Yeah.
get a prescription for, like,
Yes.
food
Yeah.
as well as your
Yeah.
medicine.
Which I mean,
Yeah.
that probably is like the piece of functional medicine, right? That you probably see as missing is that addressing of, okay, sure, we're going to start this medication. And I'm also going to have you do this prescription of X, Y, and Z that's lifestyle based.
For sure. It's really getting back to like the foundations that I think is missing a lot. Like I remember when I was sick with Lyme disease and I went to the functional provider and she asked me like, what's your diet like? Are you exercising? How's your sleep? And I mean, I had seen 10 plus doctors at that time and nobody had asked me any of those questions,
Mhm.
which are so key to like
Yeah.
how I was feeling and what was going on, right? So yeah, the foundations are really key.
Yeah. That's such a huge piece.
So as far as getting a prescription, is that something that has to be compounded, or is it just a straight prescription? I'm just curious.
Yeah, I've only found them compounded. I don't know of any like generic pharmacies really making it in the lower doses. You can get obviously the regular naltrexone for alcohol use disorder, but to get it for low-dose naltrexone, you typically get it compounded. And so you would see a provider. Some conventional providers know about this and will use it, but it's not a medication that we really learned about in conventional schooling. So you likely probably should go to a more functional provider. They might just know more about it. Or you can always reach out to your local compounding pharmacy and they can give you a list of people who are offering it as well.
It's always a really nice backdoor hack that I never thought of.
Yeah, I never thought that either.
You know, that like talking to the individuals who are prescribing it, like from the pharmacy, is really smart because it gives you an idea of, well, who is regularly prescribing this, who knows about this, and who can help me that's local is like a really nice way to approach it, especially if you like live in a small town or coming into a pharmacy from an area that it might not be as popular. My last question was affordability. Do you feel like this is like a good go-to for a drug for individuals who like maybe used to paying for like an antidepressant, like looking at those details?
Yeah, so the thing with a lot of compounded medications is depending on your insurance, it likely won't cover it. But I have found it's not an expensive compounded medication, in my opinion.
That's awesome.
So it can be a good alternative. If you're getting your antidepressant fully covered, it's going to be way cheaper, but it's not like a crazy expensive medication. It's not as much as the peptides and that kind of thing. So I feel like as for a compounded medication, it's very doable.
I love that. That's awesome. Well, I think this gives people like a really good curiosity spark. Like I love that of knowing like those symptoms sound like something I'm experiencing and this sounds like accessible and doable.
Could be a great solution. Well, and it sounds like also like it's a part of what you do, but it's not everything that you do. So where can people go to find out more about what you offer in your practice?
You can always follow me on Instagram. I'm Wellness with Everest. And then I have links to both. I have my functional psych practice, and then I actually co-founded a more general functional medicine practice. So you can either look up Everest Functional Psychiatry and Wellness or Evergreen Functional Collective. But Instagram's a really easy way to reach me if you just want to like reach out, chat more, and I can kind of guide you to the right place.
Wonderful.
That's
Well,
awesome.
before you leave, tell us your favorite brain nourishing food these days.
Ooh. So as a functional psych provider, I'm really big into healthy fats because that's what our brain loves.
That's right.
So my favorite is salmon and avocado, but there's so many out there. Getting in those healthy fats and omegas can be really, really helpful.
You can hang out with my son any day because that's
He
his
loves
favorite
salmon.
food. He's obsessed with salmon.
I do too.
Her son was
Good for
obsessed
him.
with salmon. when he
He's
was
on the
little,
right
too.
track.
Yeah.
He was. I'm like, yes, just keep gobbling that up.
Yeah.
Well, thank you so much for being with us and just
Yeah.
sharing your expertise with us.
Thank you, Everest.
Thank
We
you,
learned
guys.
so much.